Chest pressure after eating can feel scary, especially when you don't know what's driving it. The tricky part is that several common causes can feel almost identical in your body. One person feels a tight band across the chest, another feels heaviness, a lump in the throat, or a need to take deeper breaths. The three big buckets are reflux, anxiety, and posture or muscle tension. And sometimes it's a mix, not just one. The goal is to notice a few key patterns: timing, triggers, and what makes it better or worse. That helps you decide whether this sounds more like digestion, stress physiology, or mechanics. We'll also cover red flags that should not be ignored. By the end, you'll have a simple way to sort the possibilities without guessing, and you'll know what details to bring to a clinician if you need one. Moving to slide 2. First, a quick map of what chest pressure can mean. Your chest is crowded real estate. You've got the heart and lungs, but also the esophagus running behind the breastbone, the diaphragm underneath, and a web of muscles between the ribs. Sensation from the esophagus often feels central, like pressure or burning behind the sternum. Muscle tension can feel more surface level, like soreness or a tight strap. Breathing-related tension can feel like you can't get a satisfying breath, even when oxygen is fine. And anxiety can amplify all of these signals, making normal sensations feel urgent. That's why location alone doesn't solve it. Instead, focus on the story: when it starts after meals, how long it lasts, and whether it comes with burping, throat symptoms, or a stress spike. Those details are the difference between random worry and a useful pattern. Moving to slide 3. Let's start with reflux, because it's one of the most common meal-related causes. Reflux happens when stomach contents move upward into the esophagus. The esophagus isn't built to handle acid or digestive enzymes, so it reacts with irritation and spasm. That can feel like burning, but it can also feel like pressure, tightness, or even sharp pain. Many people don't realize reflux can show up without classic heartburn. You might notice frequent throat clearing, a sour taste, hoarseness, or a feeling of something stuck in the throat. Reflux often starts within minutes to an hour after eating, especially after large or fatty meals. Lying down or slouching can make it worse because gravity stops helping. And if you're burping more or symptoms improve when you're upright, that leans reflux. It's not a diagnosis, but it's a strong clue. Moving to slide 4. A key reflux mechanism is the lower esophageal sphincter, a valve-like ring between the esophagus and stomach. After you eat, the stomach expands, pressure rises, and that valve can relax more than it should. Certain foods and drinks can also lower the valve's tone in some people. Common examples are high-fat meals, chocolate, peppermint, alcohol, coffee, and very spicy foods. Another factor is delayed stomach emptying. If food sits longer, there's more time and pressure for reflux to happen. Even tight clothing or a belt can increase abdominal pressure and push contents upward. You might also notice symptoms with big late meals because you're more likely to recline soon after. None of these triggers are universal, which is why tracking your personal pattern matters. Think of reflux as a pressure and valve problem. Moving to slide 5. Now let's talk about gas and bloating, because they can create real chest pressure without classic reflux. When the stomach is distended, it pushes up against the diaphragm. The diaphragm is your main breathing muscle, and it shares space with the lower lungs. So distension can create a sensation of tight breathing or heaviness in the lower chest. Some people also get more belching, where they feel pressure that moves, changes, and releases with burps. Carbonated drinks, fast eating, chewing gum, and talking while eating can increase swallowed air. Certain carbs can ferment in the gut and create gas, especially in people with sensitivities. This is where pressure can feel mechanical, like your torso is crowded. The big clue is that the sensation often fluctuates and improves when gas moves. If the feeling is strongly linked to bloating, think distension and diaphragm, not just anxiety. Moving to slide 6. Anxiety is the next big bucket, and it can show up right after eating for a few reasons. One is body scanning. If you've ever had reflux or a scary sensation before, your brain may start monitoring your chest after meals. Another is the normal shift in blood flow after eating. Digestion increases activity in the gut, and some people interpret that internal change as something is off. Anxiety also changes breathing. You may start taking shallow breaths, sighing, or subtly overbreathing, which can tighten chest muscles and create pressure. The sensation is real, even if the driver is stress physiology. Clues that point toward anxiety include a sudden wave of worry, tingling in hands or lips, a racing heart, or symptoms that peak quickly and then fade. Also, anxiety-related pressure often improves when attention shifts or when breathing slows down gently. Moving to slide 7. Here's the breathing piece in plain terms. When you're anxious, you may breathe a little faster or deeper than your body needs. That can lower carbon dioxide in the blood, which can cause lightheadedness, chest tightness, and a feeling of air hunger. At the same time, the muscles in your neck, shoulders, and between the ribs can tense up to help you breathe. That tension itself can feel like pressure or soreness across the chest wall. After eating, this can be more noticeable because the diaphragm already has less room if your stomach is full. So you get a double effect: less comfortable diaphragm movement plus stress breathing patterns. A useful clue is whether you can reproduce the sensation with a few minutes of shallow upper chest breathing. If yes, mechanics and anxiety may be involved. If the sensation is tied to sour taste or throat symptoms, reflux is more likely. Moving to slide 8. Posture is the third major category, and it's underestimated. After eating, many people slump on the couch, lean forward at a desk, or curl over a phone. That position compresses the abdomen and the ribcage at the same time. Compression can increase reflux risk, but it can also create pure musculoskeletal pressure. When your shoulders roll forward, the chest muscles shorten and the upper back stiffens. That can create a tight, heavy feeling across the front of the chest. If you also brace your core, you raise pressure under the diaphragm. A big clue is whether the pressure changes when you sit tall, gently open the chest, and let the belly relax. If the sensation improves within a minute or two, posture is likely contributing. Posture issues also tend to be more one-sided or linked to a specific spot you can press on. Reflux is usually more central and internal. Moving to slide 9. Let's make this practical with a simple comparison you can run in your head. Reflux tends to follow food triggers, larger portions, and reclining. It may come with burping, throat clearing, or a sour taste. Anxiety tends to come with a surge of worry, a racing mind, and breathing changes, and it often improves when you feel reassured or distracted. Posture tends to track with how you're sitting, bending, or bracing, and it often changes with movement. Also pay attention to timing. Reflux often builds as digestion starts, while anxiety can spike instantly. Posture-related pressure can start as soon as you slump. And remember overlap. Reflux discomfort can trigger anxiety, and anxiety can worsen reflux by increasing sensitivity and changing breathing. Your job isn't to label yourself. It's to notice which pattern is strongest most of the time. That's what guides the next step. Moving to slide 10. Now, a few other common contributors that can sit in the background. One is esophageal spasm or hypersensitivity, where the esophagus reacts strongly to normal stretching or mild reflux. That can feel like squeezing behind the breastbone. Another is costochondritis, irritation where ribs meet cartilage, which can feel sharp or pressure-like and is often tender when pressed. Food intolerance can also play a role by increasing gas and distension, especially with certain fermentable carbs. And for some people, caffeine can drive both reflux and anxiety symptoms at the same time, which makes the picture confusing. None of these are things you can confirm on your own, but they explain why symptoms don't always fit neatly into one box. If your chest pressure is frequent, tracking what you ate, how you sat, and your stress level can reveal whether the pattern is digestive, mechanical, or nervous system driven. Moving to slide 11. Let's talk about red flags because chest symptoms deserve respect. If you have chest pressure with sweating, nausea, fainting, or pain that spreads to the arm, jaw, or back, that needs urgent evaluation. The same is true for severe shortness of breath, new confusion, or a sense of impending doom that feels different from your usual anxiety. If the pressure happens with exertion rather than meals, take that seriously. Also watch for trouble swallowing, vomiting blood, black stools, or unintentional weight loss, which can point to significant digestive issues. If you're older, have diabetes, high blood pressure, high cholesterol, or you smoke, The threshold for getting checked should be lower. Online pattern matching is not a substitute for a real assessment when symptoms are intense or new. It's better to be cautious than to explain away something important. Moving to slide 12. If your symptoms are mild to moderate and recurring, the most helpful next step is collecting clean information. Use a simple log for 1 to 2 weeks. Note the time you ate, what the meal was, portion size, and whether it was fatty, spicy, or acidic. Note your posture for the next hour. Upright, slouched, lying down. Note stress level and whether you noticed worry or rapid breathing. Then record what the pressure felt like: burning, squeezing, heaviness, sharp, or air hunger. Also note what changed it: standing up, walking, burping, loosening a belt, or slow breathing. This isn't about perfection, it's about patterns. With that log, a clinician can more easily decide whether reflux evaluation, anxiety support, or physical therapy style approaches make sense, and you'll feel less stuck because you're working with data instead of fear. Moving to slide 13. Here are a few low-risk experiments that can help you separate causes without trying to treat anything. First, try staying upright for 30 to 60 minutes after meals and see if pressure drops. Second, try smaller portions and slower eating for a few days, especially reducing very fatty meals, and watch what happens. Third, do a posture reset after eating. Feet on the floor, shoulders relaxed, chest gently open, and belly not braced. Fourth, if anxiety seems involved, try 2 minutes of slower breathing with a long exhale, and notice whether the pressure softens. You're not forcing a deep breath. You're letting the breath become quieter. If these changes consistently shift symptoms, that's useful information. If nothing changes and the pressure is frequent, that's also useful, because it suggests you should discuss it with a professional. The win is clarity, not willpower. Moving to slide 14. To wrap this up, chest pressure after eating usually falls into reflux, anxiety-related breathing insensitivity, posture and muscle tension, or some combination. Reflux tends to track with food triggers, burping, throat symptoms, and reclining. Anxiety tends to track with worry surges, air hunger, tingling, and fast peaks. Posture tends to track with slumping, tight chest muscles, and quick improvement with repositioning. The safest approach is to respect red flags and otherwise collect a short pattern log so you're not guessing. If you want one simple question to ask yourself, it's this: does it change more with digestion, with attention and breathing, or with position? If you found this breakdown helpful, subscribe for more clear, practical explanations of common symptoms, and leave a comment with your experience. Does your chest pressure feel more like A, burning or sourness, or B, tight breathing and tension? This information is not a substitute for medical advice.